See, that is the greatest problem in the practice of Ayurveda. People are having some misunderstanding about the medicines and also the practice and the consuming. In all aspects, there is some misunderstanding. I think the first and foremost problem in their mind is there is some pathyas in while using Ayurvedic medicine. That means they believe that non-vegetarian items cannot be used or this food cannot be used, like that. So many things they have in their minds. So they think it is better not to start that, because since if I am starting to use Ayurvedic medicine, I will have to do like that, have to do like that, like. But the actual fact is not that. All the restrictions, the pathya means some restrictions in food items or in some habitual factors, that is known as pathyas. And these restrictions are not for the Ayurvedic medicine but for the disease. Because each disease has its own trigger factors or some positive factors and negative factors, like that. And any negative factors, that means any trigger factors for that disease, known as apatyas. Any positive thing which will be ready to control the disease, that type of factors are known as pathyas. That means when a doctor prescribes some pathyas or apatyas for a particular patient, it is actually for the disease, not for the patient. For example, if a doctor says that sugar cannot be consumed by a diabetic patient, is that restriction for the insulin? No, it is for diabetes. Because if he is not taking insulin, this should be performed more seriously. And only for some disease only these restrictions are prescribed by a modern system. But in Ayurveda, the reason for each disease or the causative factors of each disease is already confirmed. So that doctor will say, if for a particular patient, all the pathyas and apatyas, because when it will be triggered and how it can be controlled. For that, his dietic factors and also other habitual factors are highly influential. That is what is meant by pathyas and apatyas. So it is our duty to convince them like that. For example, for a tonsillitis patient, everybody knows cold items or ice creams are not good. And even though he is taking some medicine, he has to control these factors. Then only the treatment will be successful. That means that is the patya or apatya. That is not for the Ayurvedic medicine. Whether he is taking Ayurvedic medicine or allopathy or homeopathy, these are the basic factors. Like that, the Ayurvedic doctor or Ayurvedic system prescribes positive and negative things for each and every disease. That is advantage of the system. So sometimes even without medicine, if you are doing all this, practicing all these restrictions in their daily life, the disease may be sometimes already cured by itself without any medicine. So it is absolutely necessary that a person has to take these restrictions. Then another thing is, there are some disadvantages like poisoning, or there is lead in that and mercury in that, like that. So that also is a very, actually it is a misunderstanding. And these are metals and other non-metals are equally used in Ayurveda. But we know in our body there are metals. With that metal there is phosphorus, there is calcium, there is iron. We know that allopathy doctors get iron tablets. That is a metal itself, iron or calcium or phosphorus, everything is given. There is a deficiency of iodine, then iodine is supplied. So in Ayurveda, we are using these items as medicine in another form. It should be transferred to consumable or absorbable or in such a way that it should be assimilated into the body. So it is not an poison when it is taken as a correct way. But just like any other medicine, wrong time, wrong dosage is always dangerous. That is the case not only with Ayurveda, any system. If it is taking unwanted dosage, need not go to the case of medicine, even food items. Suppose we are taking some food items which is not suitable for his body, what will happen? It is dangerous. Food poisoning, isn't it? Sometimes there will be diarrhea or some vomiting. Like that happens. So everything should be according to the nature or the digestive capacity or the absorption capacity of that particular patient. It is not the question of poison. If there is anything like that, it is a wrong medicine or wrong dosage and a wrong time of usage. That is the reason. In otherwise, it is quite positive. We can use it in all many diseases are having this type of medicines for their curative purpose. So that is another misunderstanding of Ayurvedic medicine. There is the next is one taste. All medicines are bitter taste and it cannot be taken. That also is a wrong thing. There are so many methods how we can change the taste. Just like taking these abstracts or taking in a distillation method, like that we can change it. But in the raw form has always its own advantage. That is a fact. So it should be, the preparation should be correct. So that also can be changed. So these are the misunderstandings, I think. Then another thing is, if you say long course of medicine is necessary, that also is a misunderstanding. That also is according to the condition of the disease. What happens always in most cases, people are coming to Ayurveda with a chronic disease in which the other systems has already failed. In such a condition, sometimes the patient will have to continue the medicine for a long period. Just to think of diabetes, the patient is taking the medicine lifelong. What about hypertension? What about cardiac patients? What about asthma patients? They have to consume the medicine lifelong. So that depends on the nature of the disease, the pathological change of the disease, not because of Ayurveda, homeopathy, allopathy, like that. So if a chronic patient having a disease which is to be maintained with the medicine, then he has to take the medicine for a long time. But there are so many conditions that can be cured within some short period. That is on the basis of the clinical condition or the nature of the disease, not on the basis of system. This is another aspect we have to face and to control. Then comes one more thing. Some medicines, some diseases are more prone to Ayurveda. Some disease can be treated only in allopathy. Like that they believe. That also is a wrong concept. There are methods in Ayurveda for all disease. But it varies from patient to patient and from one clinical condition to another condition. So that is on the, that depends the expertise of that particular doctor who is handling the case. So these are the main concerns, and it is the duty of the doctor, a doctor who is practicing Ayurveda, to convince the patients. Once they get convinced, they are clear, they very well understand their problem and they are cooperating. In my experience, they are actually people are interested in Ayurveda, they like Ayurveda, they believe Ayurveda. That I can very well understand. But these types of questions in their minds, that is to be convinced by the doctor, so that they will be easily coming to Ayurveda.